Hi, I'm Dr. Michael Moutoussis, and I'll give you a very brief introduction to functional neurological disorders and how we treat them in University College London hospitals. So, what are functional neurological disorders? First, they are neurological disorders that involve the brain and neurological symptoms. However, we also see them as psychological disorders, not in the sense that they are in the mind or just in the mind, but in the sense of the information processing in the brain going wrong. So they involve maladaptive patterns of activity in the brain. So, functional neurological disorders are treated by neuropsychiatry departments like our own. And neuropsychiatry is a branch of medicine that deals both with neurological symptoms but also with mental health symptoms and classifications. What do we believe that is involved in functional neurological disorders? We believe that we all have protective responses in the brain that are triggered when the brain perceives different forms of threat. And usually these keep us safe. However, in some people, these protective responses go wrong. They become maladaptive, they interfere with people's lives, and worst of all, they impair recovery from the condition itself. So now I'm going to give you some examples of functional neurological disorder. In my first example, Mary is a 39-year-old mother who's very busy and also has other caring duties. One day, she experiences weakness down the left side of her body and also slurred speech, as if she has a stroke. However, no stroke is found. She's sent home from hospital and unfortunately her symptoms persist. In my second example, Tom is a 57-year-old social worker, again a very busy man. One day, he experiences a fall and a seizure. He's taken to hospital, but no epilepsy is found, no other brain damage is found, and he's sent home. However, his seizures continue and he can no longer work. In my third example, a 19-year-old man goes out with his friends and falls and has a significant injury to his back. He gradually recovers from the back injury, but he finds that his legs are weak and they shake when he goes out. So now he has to use a wheelchair when he goes out all the time. In order to treat functional neurological disorders, we see the mind and the brain as two sides of the same coin. We use psychological approaches to treat symptoms like problematic thoughts, difficulties remembering, difficulties with attention, stress responses. And we use physical therapies to deal with symptoms like difficulty walking, weakness, difficulty seeing or hearing properly. The approach that we use in our hospital is a two-way learning approach. We use psychological therapies on the one hand, and we will ask you about your story, how the symptoms developed, how you cope with them in life at the moment. And we are going to teach you new ways of coping with the symptoms and managing other difficulties in your life. However, we also focus on physical therapies, and we will show you how to move, how to develop physical habits to keep you healthy and strong, and we'll help you learn new patterns to overcome these unhelpful, maladaptive patterns of activity that I described before. So in summary, functional neurological disorders are best treated in neuropsychiatry departments. They are disorders where the structure of the brain remains essentially normal. However, different reasons come together so that the function of the brain is impaired, and that's why we call them functional neurological disorders, and then the body is affected as well. We use a two sides of a coin approach in our hospital, both psychological and physical therapies for rehabilitation. Finally, I want to thank the UCLH Education Department and the Friends of UCLH for making this video possible.